Hi, my name is Alexandria Palmer, class SPCE 683-805. This is case study number 1. Today we're going to be reviewing the records and available data, determining the needs for behavior analytic services, identifying and prioritizing socially significant behavior change goals, describing the common function of behaviors, interpreting the function of assessment data. So the learner that I'm doing my case study on is a 5-year-old. Some of the behaviors that this learner has is aggression, self-injurious behaviors, which is SIB, and then disrobing. Communication-wise, this learner can say between 2 or less words and also can use pointing for communication. Daily living, this learner is independent eater, potty trained, but does need assistance with any dressing. So we're going to be reviewing records and available data such as education, medical, history, and historical at the onset of the case. So what that is it's used to address if there are any other variables responsible for behaviors that may occur, such as for this learner has a history of febrile seizures. Due to this diagnosis, the learner does get hot, and this contributes to the learner engaging in that disrobing. So they kind of go hand in hand. So knowing the medical history lets us know why some behaviors might be occurring. The next thing we're going to talk about is determine the need for behavior analytics services. So by doing an initial assessment, you can determine what services are needed for each learner, whether they need full-time services, which is 40 hours or less. The center does offer half days. We do have some half-day students who attend school and attend the center for services. For this learner, during the initial assessment, it showed that the learner needed 40 hours of therapy was recommended due to behaviors for decrease. Next, we're going to talk about social significant behavior change goals. So what this is goals that will help improve the learner's quality of life. And for this learner, we wanted to focus on communication so that the learner is able to tell people what the learner needs or wants, and then decreased undesired behaviors to help with the transition from our ABA center to a less restrictive environment, such as a school. And social interactions, the learner does have some peer AGG and does not play well with others. So some social skills to help improve their quality of life of being able to tolerate being around others, and being able to be around other learners to go to the school environment. The next one is functions of problem behaviors. This is F6. There are 4 functions to a behavior, and that is sensory, tangibles, escape, and attention. For this learner, the learner used to have a lot of self-injurious behavior, but recently it's come back and more frequently with the antecedents and the function being unknown. They started to have the staff collect ABC data so that we could help figure out the function. So the last one we're going to talk about is interpret functional assessment data. So a form of collecting data to determine the function of a behavior. We use ABC data to collect and determine what the function was for the SIB, and also to see what the antecedents were that were causing it, because we could not pinpoint what the function was as it was going out throughout the day. We ended up deciding that there was 3 functions, and that would be escape, access to tangibles, and attention. So for the escape, the learner would engage in that SIB when a token board was presented. And then for attention, the learner would be playing with the toys, have access to all the toys, but then engage in SIB while making eye contact with the tech. And then for access to tangibles, the learner would be walking through the hallways and see a toy that a friend had, and then engage in SIB because of denied access. So all of these assessments are important to help determine not just what the function is, but to help get an understanding of what intervention is needed for these behaviors.